Good morning, everybody. My name is Hillary Selvin. I'm the Executive Director of the National Council of Jewish Women in Los Angeles. Today we are showing solidarity for the rally on Stand Up for Women's Health that's happening right now in Washington, D.C. Sorry, that was good. We have a list of organizations and supporters that are here with us today, and I'd like to read off who they are. From the ACLU, Hector Villagra, thank you. Executive Director, the California Religious Coalition for Reproductive Rights, Reverend Louis Chase and Mary Larson. Councilmember Abby Land, City of West Hollywood, and her deputy Corey Plank. Councilmember Paul Koretz, City of Los Angeles. Sheila Kukan, his deputy. City of West Hollywood Women's Advisory Board, Marcy Norton. Rabbi Denise Ager, Congregation Kolami. From Hadassah, Elizabeth Berzon. Hollywood Chapter Now, Lindsay Horvath. From Na'amat, Aviva Levine and Hillary Botchin. From the National Council of Jewish Women, besides myself and our next speaker, is Ruth Zaitsu, our co-president. National Women's Political Caucus Los Angeles, Lindsay Bubar and Betsy Johnson. Planned Parenthood Los Angeles, Serena Giselle, Director of Public Affairs. Saban Free Clinic, Abby Land, co-CEO. Wilshire Now, Women's Reproductive Rights Assistant Project, Lindsay Horvath. State Senator Fran Pavley's office, Deputy Stephanie Molin. And now what I'd like to do is introduce Lee Salt, who's the VP of Advocacy for the National Council of Jewish Women.
Good morning, and thank you for coming. As Hillary has said, my name is Lee Saltz, and I am the Vice President of Advocacy for the National Council of Jewish Women, Los Angeles. And we are an organization that is over 100 years old. We strive for social justice by improving the quality of life for women, children, families, and safeguarding their and our own individual rights and freedom. In Washington today, in Washington, D.C., not the state of Washington, thousands of people are marching to stand up for these rights and freedoms for social justice. Rights, individual freedom, and social justice that women have fought for over many, many years. For those of us who cannot be in Washington today, we are standing together with them to show solidarity with the marchers. We are raising our voices for reproductive choice. We want to show Congress that there is a broad support for ensuring women's access to the full range of reproductive health care. We here at the National Council of Jewish Women, locally and nationally, feel strongly that we cannot allow the rollback of those rights that women have gained over many, many years. Anti-choice, anti-family legislation has moved very quickly through Congress. 2 out of the 3 bills that severely restrict women's reproductive health care choices have already been passed by key congressional committees. As the daughter of a woman who, in the 20s and 30s, 40s and 50s, marched for women's rights, can I do less? As the mother of 2 daughters who marched with me in the late 60s and 70s, can I do less? As a grandmother of 2 young granddaughters, can I guarantee them less? No, I cannot do less. We women are now experiencing unprecedented attacks on women's rights. Is this social justice? Do these 3 bills in the House of Representatives improve the quality of life for women, children, and families? We are united, standing together in Los Angeles and with those women all over the United States who are saying, enough. To quote 2 female senators from the state of Wyoming, not only 2 female senators, but 2 female Republican senators, they said, no one comes into my doctor's office to make a decision about my body except my doctor, my partner, and me. This is a private matter. Therefore, we are here to support those two Republican women and all women who believe that they want government off their back when it comes to reproductive choices. Hillary Selvin, who you've met, who is the Executive Director of National Council of Jewish Women Los Angeles, will describe these three horrendous bills that are now on the floor of the House of Representatives.
I'd like to also introduce Ruth Williams, who's our Director of Advocacy for the National Council of Jewish Women. Ruth. Thank you, Lee. As you said, women's reproductive rights are currently under relentless attack. 3 anti-choice bills now in Congress would severely restrict women's reproductive health care options through insurance coverage bans and private funding restrictions on abortion, care, and family planning services, including the defunding of Planned Parenthood. NCJW advocates and supporters have a critical role to play in standing up to these attacks on women's health care and reproductive rights. We stand together now and raise our voices to show Congress that all women deserve access to the full range of women's health care. We stand in opposition to the 3 bills now pending in the House, specifically H.R. 3, the No Taxpayer Funding for Abortion Act. It would make permanent the discriminatory Hyde Amendment ban, which is a legislative provision bearing the use of certain federal funds to pay for abortion and mostly affects Medicaid and those on Medicaid. The bill would codify the ban on federal funding for abortion, which currently must be renewed each year. It would go further and narrow the expectations to Hyde to deny care to some survivors of rape and incest. It would put a woman's health at risk. H.R. 3 would also restrict private insurance options nationwide and impose new taxes on consumers and small businesses. It would actually raise taxes on small employers if they offer this comprehensive coverage, potentially impacting 4 million small businesses, of which most are women-owned. The bill would also raise taxes and exemptions offered to consumers, displaced workers, and the self-employed if they buy this kind of comprehensive coverage. H.R. 217, Title 10 Abortion Provider Prohibition Act, ignores the reality that Title 10 funding is currently used for critical health services and education for women and also men. I heard this morning 7% of the money that is used for Planned Parenthood, 7% of the population they serve are men. Title 10 currently funds family planning training, services, and supplies like birth control, as well as related preventive care such as life-saving cancer screenings, annual exams, and STD education and treatment. Title 10 does not subsidize abortion care beyond what is legally allowed under the Hyde Amendment. Planned Parenthood in some communities is the only clinic that people have access to get any kind of health services. Representative Pence, the bill's sponsor, has said he believes it is his mission to eliminate funding for our nation's largest Title X provider, Planned Parenthood. Doing so would result in millions of women losing access to comprehensive health care. For many women and men, especially those in rural and other underserved areas, Planned Parenthood clinic is the only source of their health care. H.R. 17 would also cruelly narrow the exceptions to the Hyde Amendment, denying care to some sexual violence survivors by further limiting these exceptions to refuse care to adult survivors of incest. By restricting access to safe, affordable abortion services, many women, including those who already have limited means, may be forced to seek life-endangering alternatives, or go without buying food for their families or paying rent in order to afford care. H.R. 358, Protect Life Act, would eliminate the availability of abortion coverage in the new health care insurance market, amending the Patient Protection and Affordable Health Care Act, the health reform law that was enacted in 2010. It would ban insurance plans in state-based insurance exchanges from offering abortion coverage if they accept even one government-subsidized customer, and it would eliminate comprehensive coverage options in the exchanges, preventing all women from buying such coverage even if they paid with their own money. Currently, nearly 87% of private employer-sponsored insurance plans offer abortion-inclusive coverage. This would now be totally restricted. H.R. 358 would also expand and make permanent the discriminatory Weldon Amendment, which states a physician or other healthcare professional, a hospital, a provider-sponsored organization, an HMO, a health insurance plan, or any other kind of healthcare facility may refuse abortions, counselings, or even referrals, even in cases of rape, incest, or medical emergency, and endanger women facing life-threatening pregnancy complications. This is otherwise known as the right to refuse. This is the right to refuse service to a woman whose life is in danger. Additionally, it would let public hospitals turn away women requiring emergency abortion, a dangerous departure from current federal law on treating medical emergencies. Bottom line, all three bills, H.R. 3, H.R. 217, and H.R. 358, are discriminatory, unjust, and dangerous. It would endanger women's health, restrict women's rights, and erode religious freedom. It would threaten women's health by restricting their access to safe reproductive health care from providers like Planned Parenthood. We are all striving for social justice and equal rights to health care. We value compassion and the obligation to protect every woman's health and life, and we must safeguard our religious liberties. We recognize the issues surrounding women's reproductive choices, and those regarding abortion in particular are complex. Although we come from diverse backgrounds, we all agree that these proposals would have devastating consequences for women and their families, particularly low-income women. We call on the U.S. Congress and President Obama to reject these intolerable measures. Thank you. I would like now to introduce Councilmember Abby Land from the City of West Hollywood and the Saban Free Clinic. Abby?
Thank you. Thank you. Well, we have just heard how devastating these bills are, and make no mistake, this is part of a concentrated effort to do away with health care for everyone, and certainly this is an attack on women. It's important for us to recognize that as we stand here, there are hundreds of thousands of people behind us. We represent many, many people, and guess what? As women, we are not going back. These bills are about sending us back to a time when it was not healthy, and it is an atrocity. In the city of West Hollywood, we have a long history of supporting a woman's right to choose. The council has been unanimous, and I know this council will continue to be unanimous, because women have the right to make the decisions they need to make for themselves and their family. We believe everybody has that right, which is why as a council we certainly support a woman's right to choose. Abortion is a legal procedure. It is legal in this country to have an abortion, and there is no medical reason why suddenly it should not be available to women. I work at the Saban Free Clinic. We see women and men who come in for Title X services. This bill to take away the funding for Title X will have devastating effect. Not only will it affect Planned Parenthood, it affects many clinics throughout the country that get Title X funding. And Title X is really about preventative medicine. Title X is about making sure men and women can get screened for cancer. It's about making sure men and women have access to care if they might think they have a sexually transmitted disease. It's about men and women getting the medical care that they need when they need it. So I just want to emphasize how important it is that we stand up. We cannot go back, and we cannot let a Congress that has some ideological ideas about what is right for women and men and families take hold of this. These are medically accepted procedures. There is lots of evidence that shows that women and families do better when they have access to health care. And if these bills go forward, there will be many, many other things to take away our rights. So as a community, we need to stand up. We need to do whatever we can. We need to march. We need to write letters. And we need the Congress to understand we are not going back. We are not going back. We are going to continue to go forward as a community, go forward as a nation, a healthy nation. And to be a healthy nation, we need to ensure that medical care is available to everybody. Thank you.
Thank you, Councilmember Abby Lamb. I want to now introduce the Director of Public Affairs, Serena Giselle, from Planned Parenthood, Los Angeles.
Thank you all so much for being here today to stand in solidarity with the thousands who are rallying in Washington, D.C. to protect funding for Title X, our nation's family planning program, and for Planned Parenthood. These proposed cuts would eliminate life-saving cancer screenings, contraception, and STD testing and treatment for millions across this country who have nowhere else to go for the care and information they need to stay healthy. Let's be clear. There's been a lot of misinformation out there, but I want all of you to know the truth, which is that federal funds have never supported abortion services, except in tragic cases of rape, incest, or where the life of the woman is in danger. Too often, these proposed cuts have been misrepresented by those who have an ideological opposition to reproductive health care. These cuts are misguided and they're cruel. Here in Los Angeles, Planned Parenthood provides care to over 120,000 women, men, and teens each year at our 17 health centers. And we educate another 72,000 teens and their families about abstinence, teen pregnancy prevention, STDs, and healthier relationships. Our patients rely on us for affordable contraception so they can prevent pregnancy until they're ready to have a family. They rely on us for judgment-free, medically accurate answers to their most personal questions. And they rely on us when they're between jobs or otherwise without insurance for the basic preventive care that they need to stay healthy. Their health and their safety is what's truly at risk in this fight. And their voices are the most stunning reminder of what we have at stake. So I'd like to share with you a few words. We've had so many letters come into us from Planned Parenthood patients who are so concerned and scared by these potential cuts. One of them, a young woman named Jenny, she's 32 years old, lives here in Los Angeles, and here's what she wrote to us. I fell on hard times when I moved home to Los Angeles from New York. Like so many others, I was without a job and had no health care. At Planned Parenthood, I was given more time and attention than I ever received from my other doctors. My fear is for all the other women and men who lack health insurance and need a place to go where they can receive professional treatment. On behalf of all of us at Planned Parenthood Los Angeles, and on behalf of our patients, I want to thank you for standing with us and for standing up for women's health care.
Thank you, Serena. A couple of interesting statistics. As I said earlier, 93% of the patients at Planned Parenthood are women, 7% are men, and that number continues to grow. Another interesting statistic is that people think that these are young people that are going just to get abortions because they want to, and not because they need to, and not to get the family planning and all the other screenings that Planned Parenthood does. As a matter of fact, the majority of people that go to Planned Parenthood are now over the age of 40. So these are women going into menopause and having other issues and other health issues. These are kind of some of the statistics that are really important. Another interesting statistic is that 70% of Title X participants earn less than $8,000 a year. That is lower than the federal poverty level. Where are they going to go? Now I'd like to introduce Hector Villagra from the ACLU. He's the Executive Director in Los Angeles. Hector.
Good morning. Thank you very much. The ACLU was founded in 1920 to defend the individual rights and liberties that are enshrined in our Constitution and Bill of Rights. And we work every day to ensure that one principle is upheld, that individuals have rights that no government and no majority can take away from them. And that's why we're here today, because Congress members purporting to speak on behalf of a majority of Americans are threatening the rights of women in our country. Women's reproductive rights are under relentless attack across the country, in a variety of states, and now in Congress. The bills that these congressional members are considering are dangerous. They threaten vitally the health of women and in particular, low-income women and women of color. And so for us, this is not only about equality of rights and about social justice, but it's also about racial and economic justice. And on behalf of the ACLU's 500,000 members nationwide, and on behalf of the 50,000 members here in Southern California, we're proud to stand up today, stand up in solidarity with those in Washington who are standing up for women's rights everywhere. Thank you.
Thank you, Hector. I'd like to now introduce Reverend Louis Chase, Board Chair for the California Religious Coalition on Reproductive Choice. Reverend?
I thank you for this invitation. There is no nobler act, no greater cause of justice than to stand in solidarity with women on this day, to stand up for women's health. Prophet Martin Luther King Jr., in an epoch-making speech at Riverside Church, New York, said that silence is betrayal, and identified militarism, materialism, and racism as diversions of resources toward ends that rob us of our humanity. Today, we cannot remain silent as our resources are diverted away from programs and directions that offer quality of life choices for the poor and marginalized, largely made up of women in our community. I cannot really understand why over the years there has been this great hostility towards women by men. If my own history serves me right, my mother is a woman, and I cannot be as hostile as they are to my mother, and neither can I be hostile to women. The health issues affecting women have been under great assault by some men, with key pieces of legislation being introduced. These pernicious and evil acts imply that women who are taxpayers cannot select or benefit from services financed by their tax dollars. I'm astonished that in our age, women and women's issues can be treated so tritely, given the dastardly implications of these acts. The exceptions for the provision of abortion are torturous. For example, as is provided in H.R. 3, states that federal funds can be used for an abortion only if a woman suffers from a physical disorder, injury, or illness that a doctor certifies as posing a danger of death, severe mental distress, including suicidal behavior, does not qualify for a government-funded abortion. These acts support an intrusion of employee personal and religious beliefs in the provision and delivery of routine health care in a nation which is culturally and religiously diverse. The views of all citizens should be accommodated in the workplace. These bills are a travesty of justice, unjust, and endangers the health of women and the rights of us all. The general tenor of these bills restrict all of the possibilities of adequate medical care for women, especially from the underserved and marginalized communities, including women of color, who have made a legitimate and moral choice for reproduction. Thank you.
Thank you very much, Reverend. I'd like to now introduce Rabbi Denise Eger from Congregation Kol Ami.
Good morning. I'm Rabbi Denise Eger, and I'm the founding rabbi of Congregation Kol Ami in West Hollywood, and I have the honor of being the president of the Southern California Board of Rabbis. Today I stand up here with all of my colleagues for women's health care and women's reproductive rights as those who march in Washington carry our message to the nation's capital. This is a travesty of justice. The bills pending before Congress are nothing more than an attack on the life and health care and welfare of women. From a Jewish perspective, this is a sin. Women were created in God's image. Jewish tradition, my faith, teaches that the most important value is to save life. These bills will destroy women's lives, will destroy men's lives, will destroy children's lives, because people who really need access to the health care provided by Planned Parenthood and by other clinics through Title X will be destroyed. In the guise of budgets and government shutdowns, this is an ideological attack by a few upon the rights of the many. We've heard today abortion is still legal in this country. And if your beliefs, if your religious teachings teach you that abortion is not an appropriate choice for your family, then don't have one. But until that time, abortion is legal. And we have an obligation to protect the life of women and to protect the lives of families. So I urge all of us to work harder and join more together in coalition, and to stand up to these immoral ideological attacks from a few congressmen who don't understand the real internal life and the real healthcare concerns of the poor and of women. And we must urge our president, and we must urge the Democrats to not cave in to such demands. Thank you so much.
Thank you, Rabbi Eger. We'll have a chance for people to speak individually if anybody wants to talk to them. There are press kits out there, so if you need information, please feel free to take it. It has all the information on all the bills. I just want everyone to know that National Council of Jewish Women this past March launched an emergency campaign called Voices for Reproductive Choices. We are standing, we are fighting together with our coalition partners to end, as the rabbi said, this travesty. So please join us day in and day out. Go back to your organizations. Let everybody know. Let them write their congressmen, congresswomen. And please, please do not be silent. Silent will be the death of our rights. So we ask you all to stay vocal and stay united. Thank you.